Great. Hi, everyone. Thank you all so much for being here. My name is Tia Gangopadhyay, and I'm president of the UC Berkeley Public Health Alumni Association and a very proud double bear, and I'm delighted to be moderating today's dialogue. A few brief words on the UC Berkeley Public Health Alumni Association, PHAA. We were established in 1953 to build and strengthen personal and professional relationships among public health alumni and students of UC Berkeley. We're a 20% board dedicated to increasing the advancement of public health practice, leadership, and health equity, and we're delighted to have you all here today. A few logistics. The first half of this webinar will be moderated, and then we will open up the forum for questions from the audience during the latter half. Please type your questions into the Q&A box at any time during the webinar. You'll notice you are muted by default, and this webinar is being recorded. Students and alums, welcome. It is a very tumultuous time to be in the public health space, to say the very least, and we are reckoning with forces beyond our control. We wanted this to be an opportunity to emphasize the critical importance of public health expertise and practice. We are joined by three leading experts within different sectors of public health here today to share with you industry needs and insights on the necessary skills to be a compelling candidate in the job market of today and the future. I'm delighted to introduce Dr. Zoë Lazarre, Dr. Anand Shah, and Mr. Colby Takeda. A brief introductions of our speakers. Dr. Lazarre currently serves as the Chief Marketing Officer at Genentech, where she began her tenure in 2010 as VP of Foundational Products Franchise, where she led the US squad and network across a 17-product franchise inclusive of immunology, stroke, influenza, and late-stage oncology, with full profit and loss responsibility for $6 billion annual revenue. Her diverse background includes extensive experience in customer engagement, sales, business strategy and operations, access and managed care, and therapeutic area marketing. Dr. Lazarre is a proud Cal alum, having earned her PhD in Health Services and Policy Analysis from Cal, following her MPH from Yale and BA from UPenn. Dr. Shah is the Senior Vice President of Community and Social Health at Kaiser Permanente, where he oversees strategic initiatives and operations across KP's annual $3+ billion community health portfolio. He's responsible for developing and implementing key strategies to improve health outcomes and reduce health disparities by addressing community and social factors that impact the health of KP members and millions of others in communities KP serves. Since joining KP in 2019, he has developed the organization's enterprise social health strategy, which includes KP Community Support Hub, a national support center dedicated to helping members meet their basic needs, and the KP Food as Medicine Center of Excellence. He also oversees KP's Population Health Management Initiative and data and evaluation efforts. An emergency physician by training from Brown University, Dr. Shah has formerly served as Chief Product and Clinical Officer at Pieces Technologies, and held academic appointments at University of Texas Southwestern, UPenn, and Brown University. Mr. Colby Takeda is the co-founder and CEO of Pear, a digital health company empowering community health workers and doulas through an AI-powered platform and national provider network. With a background in public health, aging services, and health innovation, Colby leads efforts to transform how social needs are addressed at scale. Under his leadership, Pear has partnered with over 30 health plans and 300 community-based organizations to streamline care navigation, enable reimbursement, and drive health equity through culturally responsive, community-rooted models of care. After completing undergrad at Willamette University, Colby entered an MBA from the University of Hawaii at Manoa and an MPH from our very own Cal. Thank you all so much for being with us today, and we want to just jump right in and kick it off with the crux of today. What advice do you have for early careerists trying to enter the job market in your respective industries? Think of specific classes, trainings, certifications, etc., that you think will best equip candidates. I'll let you take it away, Zoe.
Thanks, Tia. First of all, thank you so much for having me this evening. This is such an important conversation, as you will hear from the three of us, about the importance of an education in public health and how it manifests every day. I have so much advice. If you are a student at Cal right now, you are getting all of the education that you need. My advice is not to go out and choose tons of different certifications and classes, but to really focus on building the most interdisciplinary program you can at Cal at this time. You will hear in the next hour my experiences in biostats in particular, in epidemiology, in clinical trial design, and then the multidisciplinary courses at Haas and the School of Public Policy. That is what I use today. And I have gone out and sought other certifications and thought about AI, but I would really focus on the core offerings that Cal has. One more thing about, the advice and the skills. Um, I think entering into the job market, especially in marketing where we are today, I'm actually not looking for individuals with 10 years of marketing experience. I'm looking for two simple things. The first is learning agility, because the information that we might teach or have you do today will change by next month, as where this was not the case 10 years ago. And so these individuals that can learn and be agile and adapt to new skills and technology. And then the second one is around communication. As AI democratizes data and all of the data is at our fingertips, it's really important to me to look for people that can interpret the data. So go back to your classes at Cal and then succinctly communicate a point of view and have a relationship with that data, as we look to interpret it and share the impact that it can have. I think you're on mute, Tia.
Thank you. That's great, Zoe. If you don't mind, Kobe also answering.
Yeah, I really enjoyed my time at Cal, and I think the best part of it was being able to say I'm a student and ask a lot of dumb questions and pretend like I didn't know a lot of things, and people would typically respond to you. I think leveraging your experience, either you're a recent alum or you're active student right now, reach out to your networks and build a network. Ask good questions. Whenever I didn't have all the answers, I would ask someone in my network and and grab a coffee or steal some time on their calendar, and people are willing to help students and recent alums and grads, right? They are willing to help, especially in the Berkeley network, reaching out to ask for five or some time, maybe by a phone call or grabbing coffee with them, to get their insights into the job market. Asking them for advice or asking what courses might be best suited for certain career paths. I'm in the innovation and startup space, and so I really like when students come to me with a real passion for not just solving real problems, but actually having the experience to do so. Whether they started something like a project on campus that led to some kind of business idea, or maybe they joined a nonprofit and tried to innovate there, or even explored and did an internship with another startup. That's always exciting, especially if they come with the background of public health and having the core competencies of a public health professional. I also like diversity. So not just consistent thread of experiences, but if you have diverse experiences, whether it's marketing or sales or having experience working with technology or coding, is really interesting to see kind of how over different fields overlap. I always thought I'd want to teach a course one day around public health and innovation in business, because lots of times business isn't incorporated into public health. And so just being mindful of that, consistency is great, but diversity of skills is also really great.
Thanks, Kobe. Please, Anand.
Yeah, well, thanks also for having me. And I know I'm outnumbered by Cal alum. I wish I was lucky enough to go to Cal at some point. Maybe the future will hold that. Um, my feedback for this question, certainly plus one to Zoe and Colby on their comments, is maybe I would start with the fact that you're getting a great education, and there's a blessing and curse with public health that most people don't really understand what public health is. Even in fields like healthcare. I mean, I work in a department that's really filled with public health leaders, but by and large, in the blessing and curses, I think you have an opportunity to create your own narrative to explain really the skills you have and your understanding and how that actually connects to the business problems or societal problems that the employer that you're seeking to work with is trying to solve. And I think that gets a little bit to where Zoe started in terms of your ability to communicate and create narrative threads. Because I think public health at its heart is also interdisciplinary, and I agree we should continue to work at those edges. But that is such a vital skill. The other tip I heard, I asked some of my colleagues, many of whom are Cal Public Health alums, like what advice they would give. And one thing that they shared is there's a ton of passion. It's usually a community of service-minded individuals who are very passionate about the work that they do. And sometimes in interviews, they lead with passion, which leading with passion is great, but sometimes at the expense of talking about their skills or the ability to communicate the sort of value of their experience, their knowledge base, and how, again, that will communicate to or effectuate change on interpreting data, or even core skills around budgeting or project management or data analysis or other things that you have, whether you use different jargon or labels for some of those skills. I think those are yeah, the big thing. And yeah, I love the comment about learning agility. I couldn't plus one that enough. I think in this day and age, I largely just hire for soft skills, and I think public health grads have all the soft skills that are needed. I think it's your ability to reflect that back to the individual in the language that they understand. And I think you have a leg up because you're probably doing that with professors who came from different backgrounds as physicians, as epidemiologists, as folks who've worked in upstream systems-based approaches. So anyways, that's my short feedback. Happy to add on if folks want additional comments there. But actually, one plug, I'll say KP does have a program with APHA for postgraduates, for fellows, and I'm sure Genentech and Pear and others do. But look at those too if you're looking for things that are bridge programs.
Thank you so much, Anand. The next question we have is, given the multitude of external forces impacting public health currently, when we think about the US leaving the World Health Organization, the redefining of professional degrees to exclude public health, et cetera, why and how do public health jobs still matter? And I'll start with you, Kobe.
Yeah, this is really fascinating. I think, we're all seeing changes in the job market because of it. But at the same time, I think if we think differently about what public health is, if we think of it not just as something that's in public health departments, right, or at the level where you're doing crunching numbers and supporting providers, we're actually seeing diversity in kind of skills that are required across sectors and different industries. So you'll see in food science now, they're looking for public health people to make their food healthier and present a different framing of food. We're seeing public health people working in organizations like transportation organizations. Uber has Uber Health now, right? Instacart, we're working with Instacart, and they have a health team that's working on public health initiatives. So you're actually seeing public health, I think, outside of traditional spaces, and it's because they have the experience and the ability to work across industries to improve health and well-being. And because of, even though we can't always say social drivers of health in every context, SDOH matters, and we're seeing housing, food, transportation, places where people work, employment across the government agencies. We're seeing a lot of excitement, especially around things like rural health. There's always going to be a need for public health people, and maybe the way you apply your skills in public health may change. I think we're seeing a lot of interest now in tying public health to financing and different policy changes around financing and funding, specifically around Medicaid and Medicare. And so bringing those skills and experiences to the table, you can think differently about what you can do with your degree and explore ways in which healthcare can persevere despite some of the challenges we're seeing on the policy side.
Great. Thank you, Anand. Please.
Yeah, I'll continue the thread in a couple ways. And it sort of is an extension of what I said on the front end of helping define what public health is for folks. So I'll stick with healthcare. There's certain demographic trends, right? Like we are an aging population, and I think everybody would say that the answer to are to support our older adults in America, like we're not well suited, and frankly, across the globe, there's no single answer. And then as you ask questions to get people to think about what do we really need? These are actually many of the programs and skills that you likely have worked on in which are either policy changes or developing other sort of systems-based approaches to thinking about helping individuals thrive. The same thing is happening in healthcare, the expenses of where is their growth happening in healthcare? It's in Medicare, Medicaid, dual eligible. So these are government finance programs, largely where if you ask them, how do we actually better support those individuals and not just spend more and more of our GDP on healthcare? They will start talking about issues that are addressed by public health, whether or not they use the language of public health. So helping people understand that you are adept and understand those forces and can bring solutions to that is really important. You know, I think I'll reinforce this a little bit of this is if you're familiar with the VUCA framework that folks use in the military of, it's a volatile, uncertain, chaotic, ambiguous time, that is the environment we're in. In those environments, being able to communicate with clarity is really important. And I think public health leaders are, it's more important than ever. I think you just have to help people understand it in their own way, I guess is what I'm trying to say. And if through questions and framing, I think you can get there, but you should be in high demand. And I think actually you're in an enviable position, even if it doesn't feel that way. So please keep pushing.
Please, Zoe.
It's interesting. I'm going to pick up exactly where you left off. I mean, these jobs matter more than ever because if you look broadly, I would argue that public health is the discipline that is under the most stress right now. If you think about all the changes in our government and our society, and I think it's going to take all of us as public health officials to ensure that we advance the capabilities of public health that we've been talking about. You mentioned population health, health equity, data science, systems thinking. All of these things are actually becoming, to me, more foundational leadership skills in how we lead because I do think our discipline is under that stress. And there's so many examples of how this manifests at Genentech, whether it is developing medicines or partnering with Kaiser Permanente to ensure that patients have access. So more important than ever is really the conclusion to this question.
Great to hear. And in that same vein, how are hiring needs more specifically changing then within your specific organization? And we can start with you, Anand.
Yeah, I think hiring needs, I feel like I'll be a broken record because it's a lot of what I sort of described on the front end. I'm hiring, we are hiring, and we are hiring people with public health backgrounds, and I'm hiring for uh, learning agility. I'm hiring for character traits. I'm hiring for folks who are open and interested in driving change. I think I saw a question in the chat about AI. For me, it's less about whether you can tell me the nuances of the different LLM models and RAG approaches and things like that. It's much more about how are you thinking about and willing to test and understand the edges of different technologies as they evolve, because they're going to evolve faster than whatever training or certification or certificate you have. It's how are you bringing a mindset that is open and willing to sort of test, experiment, and learn into the workplace. And yeah, so it's much more, I think, about those intangible and interdisciplinary skills, as I think Zoe mentioned on the front end, than about any specific certificate.
Yeah.
Thank you. Colby, please.
Yeah, really great question. I'll start with saying not everyone is going to thrive in a startup. We are a decently funded startup now, and we have a team of about 50. But there were times when we had, 5 and 10 employees where everyone had to do everything all the time, every day to just survive as an organization. And, we wouldn't have gotten where we are without those people. And so we've actually cycled through some individuals that just realized that a startup lifestyle isn't for them. We need people that have not just skills in one area. So we can't just hire someone who's a great epidemiologist because they got a master's or a PhD from a great school. We need people that can apply those skills and tie it to policy and make some money with it, and then tie it back to technology and product. if you can have those abilities and skills to like link everything together, you're gonna do great in a startup. Being able to be agile, like was mentioned before, being able to tie the pieces together and think comprehensively and holistically, but also think very future focused. That's what we're looking for in an organization like ours. Um, we have about 3,000 CHWs under our scope right now, and we're supporting them with a small team of 50, and that includes product people and customer success and engineers and all those things. So you can imagine that we have to do a lot of things all the time, all at once, and it gets really stressful. But we love people that are motivated and excited and want to solve big challenges and realize that this is a big chance for us to make a big difference. And you don't get these chances too often with companies. And so we're excited about people that are super motivated and forward thinking. So yeah, that's a little bit of the startup space.
Yeah, and I think on the complete 180, Genentech is probably the farthest thing from a startup. I think there's some Genentech folks probably on this call that can keep me honest. I think we have 15,000 employees in South San Francisco, in the Bay Area alone. So it's large, which basically means there's an opportunity across so many parts of the organization to apply different skills depending on whether you are a scientist or an epidemiologist or a health economist, or interested in population health or nutrition as we enter into the cardiomet CVRM space. I would say, aside from the soft skills, the two things that I am in particular looking for in the marketing organization is that ability to take AI off the page. Like Gemini, GPT, our internal tools, a million tools. There's so much data. We are inundated. And I often feel like our marketers are sometimes paralyzed. There's so much data, but then what does that mean? What do I do with that data? And for me, I feel like that's the skill. So think about when you're in those biostats or epi classes or looking at large data sets, as mentioned. How do you translate that, and what does that actually mean for your next best action? That's incredibly important. And then, I had a job, my previous job from this one, for 2 years. Every single day, I thought about clinical trial design, p values, and we were designing a pediatric stroke trial with the FDA. And that pediatric stroke is tough. And so that skill in particular to really think about experimentation and outcomes and testing hypotheses. I mean, we're doing that not just in stroke trials, but in marketing data. So that really is pervasive across all of the skills that we look for.
Yeah. Actually, if I could tag back on, because I would just say I agree with the skills that Cody said and Zoe. And in addition to the soft skills, I think it is those, and maybe I would frame them as how you branch across them. So, in healthcare, I talk about quality improvement or PDSA cycles, but it's really around experimental design, as Zoe said, or data analysis. The other one I would mention that I forgot to was human-centered design, and really being clear on how you do ethnography or ask questions of individuals and capture those sort of true insights. But it's less about being expert in any one of those, and it's being fluent about it fluent enough that you could actually do it sort of across some of those sectors, in my view.
Thank you. And you all mentioned to some degree that the importance of learning agility as a critical skill to sustain a career in public health, given all of the dynamic changes that are constantly happening. But when we think at emerging trends and emerging needs within your specific organization, where do you see the future of Genentech and KP and Pear Health, when you're thinking about biotech or behavioral health and digital health spaces? Where do you see the future in the next 5 years, 10 years, 20 years? And we can start with you, Zoe.
Yeah, I love this question. And my background is actually our Genentech's 50th year anniversary. We are the first original biotech, and we're actually celebrating our 50th year this year, which is so exciting because our company was founded in partnership with an academic and a scientist, and coming together and bridging those two disciplines. And so it's really interesting to think about the next 50 years. Emerging trends, what's fascinating about where Genentech has been from largely an oncology company specialty. Two, entering into mass markets. I mentioned obesity and GLP-1s. We have immunology with IBD. There's so many different disease areas which have a massive, massive public health impact if you think about those things, and things like influenza, right, which is part of my previous portfolio. All of those things are consumer driven. So we are thinking very mindfully about how we shift, not that we don't engage and empower and work with our healthcare professionals and our insurers, but how do we shift to this world of consumerism where I hope that consumers demand more of their health care than they can only call from 2 to 4, or else everyone else is on their lunch break. Like, how do we really advance healthcare to make it a consumer driven market like so many others around there? And I think this interdisciplinary nature of where we're going and where our public health leaders will take us is working with our health economists to think about value of our medicines to payers, providers, patients, thinking about access, and how patients access medicines and how we meet patients with a digital front door where they're at. So I could go on and on where the future is, but maybe I'll sum it up in one word of consumerism. And it's really interesting because that's quite intertwined with societal public health.
Thanks, Zoe. Anand, please.
When I think about KP's future, and I think maybe similar to Genentech, it's a large organization. It's been around for 80 years, and it's transforming. And a lot of what KP has delivered is healthcare, and healthcare largely in geographic settings, in places where it's actually fairly intensive, right? Like in California, we have the hospitals and the clinics and the physicians and the labs and an end-to-end system. And the people are moving, they're living in different places. If you're a California-based company, your employees may be all over the country. And I think to Zoe's point, the way people interface with things like healthcare are different. And frankly, we have to move from, allowing people to get, sick care to keeping them healthy, and move to prevention is the only way that we will bend the cost curve. And I know you all know this, so, try not to preach to the choir, but I say that underneath that are skills around how do you deliver really personalized approaches? How do you measure what's effective and not effective? How do you bring care that is more equitable? And like people talk about value-based care, but often value-based for the people who know how to engage, who show up, who understand how to work the system that exists. How do you do that for all in a way that is, truly equitable? Those are actually things that you've been trained to think about and dissect and understand the sort of systematic barriers. And so what we're looking for underneath that are people, in addition to what I've talked about, are I think Colby uses phrase of like future oriented, I would say, or thinking about how you bring solutions that are human centered, consumer centric, but also leverage scale and leverage technology. Like, how do you use tech for good? And it is risky, and there are biases that we should be aware of, but how do you use it towards actually reducing some of the disparities or access challenges or cost issues that stand in the way today? I think that's general approach that I would frame.
Thank you. And Colby, please.
Yeah, this is a interesting one, certainly. And I think I'll answer it with a little story about how Pear Suite kind of evolved over time. So we actually started off as a service company. During COVID, there was a lot of people that needed help, and we thought the community health worker model was the perfect community-based, person-centered approach to solve some of the challenges around education and navigation and vaccinations. Over time, we realized that we could do this, but only so much. We couldn't scale the business of community health workers because we didn't have people. We didn't have enough staff in every county, in every state, and across the country who could do all different things. We also realized that technology was a big barrier, so we started building software, and we ended up being more like an EHR company, selling software to different organizations who were doing this, and we're doing it at scale across the country. Over time, we realized that we can't just be a good software company. We couldn't just give software to groups and all of a sudden it worked and people were started, being more effective and efficient. So we had to provide them wraparound support. So we started as a company providing contracting, credentialing, compliance support. We did clinical review for our customers, and we became a platform business. And you think about other platform business models, right? This is Uber, Airbnb, all these companies that have evolved from taking, the traditional hotel model of a Marriott or Hyatt chain. They can only do so much because they're limited by space and facilities. But the Airbnb model looks at external individual facilities and uses them to build capacity. And so we similarly evolved from just a software company and a services company to a platform business model. So we now are thinking about how can we leverage our customers who are using our software to then provide services for some of our other customers, whether it's a health plan, a health system. We're even working with pharma companies to expand, how we bring community health worker services to those receiving different pharmaceuticals. We're rethinking kind of the business model of public health and getting funding in from different ways. Literally right now, we're getting funding from about 10 different sources, whether it's public health agencies, hospitals, clinics, individual providers, community-based organizations. And so we're evolving over time. And that's just the way I think we have to think in the future for public health is how can we apply public health principles to different business models? How do we align it with existing systems, but also reinvent what public health looks like in the community, whether it's in traditional industries or new industries. Eventually space will need public health. Eventually telehealth, telecom with telehealth will require public health to be incorporated into it. So I would just say think differently and then look to new spaces for where public health could be infused and really bring new revenue because at the end of the day, things have to make money for it to work, and everyone has to think that way. Which is a criticism of public health traditionally is public health doesn't promote public health as businesses. We love giving out free services. We love doing things for free and not receiving any revenue back. But if we think about revenue as a way to thrive and increase impact, it can really help us go further.
Mhm.
Thanks so much, Kobe. We are at the halfway point, so we'll move over now to questions from the audience. If you have not already put a question in the Q&A box and you're interested in asking a question, please feel free to do so now, and we'll move over to those questions. The first one we have is, as a graduate student interested in digital health and the interpretation of clinical data, what skills or knowledge would you recommend focusing on to work on AI-related health projects? Feel free, anyone that would like to take the question, you're welcome to.
Okay, I can start really quickly. It's hard to break into spaces like this without experience. But I would say experience doesn't have to be a full-time job. Experience could be a short-term summer project where you help a relative, think through an AI data project for their clinic, or maybe you did an internship with a small a startup and you got experience there. If you can show us that you can build and solve problems and give an example, that's already so farther ahead than someone who has no experience. And so I would say look at different ways you can apply. I know there's a lot of campus clubs and groups that are doing consulting for companies. Those are a great way to get your foot in the door. But also just offering to volunteer and do a project over the summer or for credit could be a good way to show that you have experience and apply your learnings to real world experiences.
Maybe I'll tag on a little bit, which is I also think experience doesn't even require a third party. Like I hired somebody who really just built something on their own. Like they thought deeply about the problem we were trying to solve, and they, especially now with things like Claude Code and Codex, and there's just so many tools that you don't have to be a technologist to build a proof of concept that sort of demonstrates your deep thinking and your ability to bring a different solution set to problems. And then networking, as I think we started also on the front end. Because I think one of the questions people are wondering about is like, I don't think a certificate or a specific experience gets you through the funnel when there's like 1,000 people applying. So the challenge is probably not going to be a keyword on your resume or things like that. It's going to be somehow getting into spaces with other individuals who might be interested, whether you think they're hiring or not. And I think that's a much more effective way to sort of demonstrate this. Unfortunately, I know that's not a straightforward path, but that's my experience.
Well, it's interesting because if we could skip around you, I feel like you just answered maybe one of the other questions in the chat, right? Which is if we apply to a position where we don't necessarily have a connection, how do we stand apart from the pack. Which I think you answered a little bit, but maybe I'll add one triple, quadruple check you actually don't have a connection, right? Like scour LinkedIn, who's your second or third connection? Like, you probably, not always, but I would say connections really, really matter in these 1,000 applicant processes. So make sure that you don't know someone who knows someone. And then um, I feel like what we talked about here today of agility, communication, these things that allow us to that are skills versus very specific courses or things that you've taken. To me, the innovation, if I can see innovation in someone's application, that's that's a green light to move forward. So hopefully it's okay, Tia, that I skipped around a little. I'm
Yeah,
reading these questions.
absolutely. If you don't mind, I'm going to piggyback with another question that got
Yeah.
asked is how would you demonstrate that, whether that's in the application or in the interview process? There was another question about just how to demonstrate learning agility.
I mean, here's a tip. Every Genentech interview question starts with, tell me an example of, as folks on the call can attest to this, but you'll often get a question of where you were innovative or where you were involved in a project where you led innovation. And my advice is interviewing is a skill that's part of the job. Be very, very crisp, whether it's a framework like the car framework, something action challenge. Here was the challenge, here's the action, here's the result. Be very clear in having those examples and experiences which you can bring to life. I've seen so many brilliant candidates who've done this work come to the interview process and they cannot succinctly articulate their role, that it was their idea, and what the impact was of the innovation. And so I would say, actually, to that answer the question, like what skills do you need? Practice interviewing. I've certainly spent years practicing interviewing, and it really makes a difference.
Thanks. So, Anand and Kobe, anything you would add both about having how to show in an interview that learning agility, but also with there's a high volume of applications, how do you stand out?
Yeah, I think iteration is always great when trying out new skills and being able to show that you've tried to build something before. It doesn't have to be successful, right? Actually, sometimes people love hearing the mistakes you made and what you learned from them and how you do things differently, or that fact that you tried something different, experimented, and what you learned from that. Like that experience is great. There's this story around the a potter who spent 10 hours making one pot. Versus another potter who made 10 pots in 10 hours. At the end of the day, who is a better potter? It's a guy who tried over and over again and experimented and got better every single time versus spending so much time on one pot crafting it and really not making much improvements because you're just working on the same pot over and over again. And so we love to see people showing that they have the experimentation, the iteration skills, and you can do so with examples or build something outside of the space that you can prove that it's you gain skills from it and learn from it.
And I was going to say actually exactly what Kobe just said, so I won't belabor it. But the notion of embracing failure and communicating that as a part of, except you don't have to call it failure. Failure doesn't have to be a bad thing. And helping reframe that you've learned, not everything went rosy, is actually validating to someone that you're taking risk. If you haven't failed, you're not trying enough, or you're not trying in the right ways. And those are definitely things I look for. And then in terms of not having connections. I think in so you probably have connections that you don't understand, like Zoe mentioned, and because you can also talk to neighbors and other things who are not on your LinkedIn and see who they know. But if you really can't find a way, I think being thoughtful about how you craft outreach, that is, not generic, but I certainly responded to folks where it's clear that they've been thoughtful about um, work that the individuals are doing or others in the company are doing that you could connect with, who then could do like a soft intro. There's one other path that I've done.
Awesome. Thank you. There's a question specifically more on international graduates and in the current funding landscape and regulatory environment, if there are specific skills or roles that international students can be more competitive despite visa constraints.
This is a really tough one. What I will say is that Genentech is a subsidiary of Roche, which is a global organization. We have more than 150 affiliates. Our headquarters are in Basel, Switzerland. This is not an advertisement, but an answer to your question of there's so many international opportunities at many large biotech organizations. So if you're looking for a job that is not in the US, I think more and more the skills are applicable. One of the parts of my role right now is actually working with our global pharma international colleagues to think about the global future of marketing. And we're thinking about shared products, shared like meta tagging and damn data and systems and all these things that actually have such a global component. And so I think yeah, we're much closer to our global colleagues than we were even 18 months ago.
Anything you want to add on under Kobe?
Uh, it's pretty hard for a startup to kind of afford or overcome the barriers of visas and whatnot. I will say we have a lot of contractors, however, that are out of country, and we're leveraging them to kind of fill in some gaps in our team. But yeah, we typically have to make good decisions around being cost conscious, and that's one of the areas that it's a little tougher for us.
Nothing to add except to say, I would be direct in questions because the organizations are often clear about what they can provide or can't on the front end so that you don't waste a lot of your own time. But I don't have any other specific tips, unfortunately.
So in Kobe, you mentioned contracting. So that's a good segue to another question we received around whether your organizations have interest in short-term or longer-term consulting support rather than as an employee.
Yeah. I feel like I've been talking. Does someone else want to go? I mean, very, very briefly, absolutely. Yes, we work with a lot of consultants because as we think about where the future is headed, oftentimes we don't, things, information is moving and changing so fast. It would be, it would not be efficient for us to do all of those things in-house. So we have a very specific strategy of where we have consultants, whether they're healthcare providers, like Dr. Shah, or they are small consultant agencies with a specialty in let's say access, or they're large McKinsey, Accenture type organizations. We work with a lot of consultants. It's very, very strategic. And in fact, we have a lot of debate amongst leadership of, in-house or consultant and where is that appropriate. And again, I go back to things change just so rapidly. It would be impossible for us to do everything in-house. So absolutely, yes.
Yeah, we have quite a few consultants as well, and obviously we don't have all the skills in house, so we definitely leverage them. I think we are not in the interest of getting people to just give us reports back and give us briefs. I think we want people that can actually produce and show the ROI for us immediately, so we can validate the investments are actually producing some return.
Great point.
Awesome. Anything to add, Anand, before we move on?
Yeah, just plus one.
Perfect. So then we received another question. You mentioned earlier, Kobe, around scaling Pear Suite. And this question asks, concerning new ways of financing healthcare, either in the public or private sector, what are some reasons that prevent these innovations from scaling now?
Yeah, it's an interesting balance. I think when we raised our funding, a lot of our investors were like, "Oh, how are you selling to health plans? How are you selling to big, six-figure contracts?" And the reality is, they don't move that fast, right? They don't move fast. They aren't interested in working with startups all the time. You have to find ways of generating revenue at scale, and we can't wait 2 years for a contract to close from introduction. So, unfortunately, that is a barrier. A lot of these systems are slow, and change is hard. That's oftentimes why these organizations can't innovate both internally and externally, is that they just aren't ready to change. And a quick example, there's a, if you're in California, you know that there's Medi-Cal members, and there's a program called CalAIM. CalAIM was all about rethinking how we're serving the Medi-Cal population. Health plans didn't know how to work with community-based organizations. Think a YMCA, a Catholic Charities, a food bank. But this whole, opportunity through CalAIM was like, how do we contract with these providers? And there was all these blockers. Everything from these organizations are on paper and spreadsheets to a lot of these organizations hire people who have historical backgrounds in the prison system, and that those background checks wouldn't go through. So all of a sudden you see all these blockers that come up from these health plans. And so we had to overcome them together with health plans. And it took, years to figure this out. Everything from how do we contract with a nonprofit who doesn't know what an NPI is, which is provider information that you would have for a clinic or a health clinician, to how do we get claims in? They don't have a technology system. So yeah, sometimes we love when we bring expertise to these old traditional systems and help them rethink and do things simpler. We love bringing firsthand experience to the table. So we actually bring some of our community-based partners to the table with health plans to help them, see the differences and how we can, what's the benefit of working with a food bank or a barber shop to think about colorectal cancer screenings for Black men in South LA, right? Hearing from the people on the front lines has been able to change their thinking and their strategies around working with community-based partners. And I think we've been able to change some of the speeds in which we can innovate. But yeah, finding ways to work with these traditional partners. I think there's also a lot of technology changes that's making it simpler, and also policy changes is kind of driving this and forcing people to adapt. And so leveraging these other external factors to kind of push these traditional organizations can been really successful for us.
Thanks, Kobe. Zoe or Anand, anything to add?
I would just say I was at JP Morgan a few weeks ago, and the economy of healthcare it's just unforgiving. It's so hard. There's so much regulatory uncertainty. It's tough. And Colby, I really nothing more to add. And I appreciated your comments.
Thank you. There was also a question that touches on the soft skills that you all mentioned and the importance of it. But on the flip side, do you have any advice specific to those that are switching from a non-public health or non-healthcare career for them to stand out or to balance those soft skills with potentially more public health specific competencies?
Yeah, maybe I'll start. It's a great question. And I think maybe a couple of framing comments I'll just say around jobs in this arena is there's often no perfect job. And so sometimes it's much more about picking the organization or ideally the boss or both and less about the role. I'll say I have two or three leaders on my team. Actually, one of our vice presidents, he started as a scheduler for HHS and then 4 years later became the chief of staff for the principal. And so getting your foot in the door is really important and can't be, I think, overstated. And that's not saying you have to take that path, but any foot in the door for a good organization with the right team and culture, I would encourage you to think about. And if you don't know the teams or cultures, I think there's actually a lot of community events and just different types of meetups and things happening these days, both virtual and in person that I actually think you can show up to. And the last thing I'll say is I'll be a hypocrite. I was not good about asking for help in those types of settings. I'll just say, but now on the other end, I appreciate it. I'm never annoyed by anyone who's honest about them being an early career or looking for roles or thinking about an intro. I actually want to pay it forward in whatever way I can. And so I'd encourage you to be vulnerable and show up at these places and just share where you are in your journey. And I think you'll be surprised by the human kindness that you encounter.
Thanks, Anand. Zoe, Kobe, anything you want to add? Okay, great. There's a comment and a question around public health fatigue, which is very real right now, given we've moved from a sprint during the pandemic into a marathon with shifting political landscapes, funding cliffs, regulatory whiplash. How do you all stay resilient in your careers? And if you have any advice for those who are joining the workforce?
This is a great question. What I would say is this is a little bit of a personal answer, but what motivates me to go to work and leave my family and spend hours on the road is the real opportunity to make an impact. Um, we're not making widgets, we're making medicines at Genentech that I know so many people who are on our medicines. And my experience recently leading our flu portfolio and quite frankly, working with the administration on a direct to patient program and then seeing the data roll through month by month of how many more people were able to access flu medicines at an appropriate price. I mean, it's motivating. And so, yes, there is fatigue. There are so many barriers. This past year, 2025 in particular, has been really, really tough with pricing pressures and all of these different things. But I would just anchor back to the impact, whether it's one individual. Back in the 10 years ago, I was working a needle exchange program in the Tenderloin, whether it's one individual that you help or it's a mass policy that you change to get access. I really think it's about that impact. The only other thing I would add, because I'd like to hear from others, but at Genentech, I change roles every 2 to 3 years, and it actually helps me with some of the fatigue. Really, it's really hard, and you're encountering the same problem year over year. And at Genentech, there actually is an opportunity to flow and move to different parts of the business. You can switch from analytics to marketing to sales to operations to medical. And I think that has helped me professionally with some of the fatigue and why I've been at Genentech for 16 years.
Thanks,
Maybe
Zoe.
I'll tag on and I'll probably start where Zoe started a little bit is I think there's in times of challenge, it's really hard. It's really meaningful to find purpose. And the beauty of this work is I think it's often very tied to impact and purpose. So I'm an ER doc and it's also chaotic by nature. And one of my closest friends is the dean at Yale, who's also an ER doc, Megan. And we've talked about this, both the ER piece and the public health piece. And in the emergency department, you really just have to think about what's the next patient, how do you really focus on them and bring your values forward of trying to support them. And in the public health arena, in our current roles, I think it's the same arena that we're lucky enough to try to make decisions on a daily basis. There's a lot of things we can't control, but we can focus on really important problems in small and significant ways on a daily basis. And I think if you can hold on to that, it can be enriching. But I want to validate it's hard. I know it's hard to get there, but I'll just say that's what serves me. And I think it's true of some other colleagues that I've talked to.
Yeah, I'll just add that problem solvers and entrepreneurs and innovators sometimes thrive in these challenges times. Like this is a call to us to like act and come forward and like figure out how to, get stuff done. Um, just some examples, right? Like COVID was a time to people shifted their business models and they adapted and they found ways to, step up and we
Yes.
worked long hours and we saw big challenges, but that was what we did to, make sure that people got the care they needed. Um, the fires both on Maui and in LA were calls to action for community health workers to step up. And we had to act. We worked long hours. We didn't sleep some nights to get, our CHWs deployed, but it solved real problems and brought us purpose, like was mentioned. That was huge. So yeah, I mean, even now, I think there's a lot of need for what we're doing because of policy shifts, and actually is driving more of our work. And despite some political challenges here and there and policy challenges, I think there's still a lot of ways in which organizations are being funded and funding that's out there to you just have to just maybe tweak the framing of how you think about things and look for other sources of funding. We're seeing a lot of shifts in money going through state or organizations or health plans or health systems that you might have not thought before. But it's exciting for us specifically. But yeah, I would see if there's a way to reframe how you think about the changes and look at them as opportunities.
Thank you. I realize we're nearing time, so I think we'll be able to squeeze in hopefully two more questions. Given all the changes and challenges that we discussed today and a lot of uncertainty, there's a question around what each of your respective organizations are focusing on from a workforce development perspective. Beyond technical proficiency or AI literacy, are there specific human-centered competencies like systems thinking or community-based leadership that you're prioritizing to ensure your teams remain effective amidst all of the volatility?
I can give a short response. I mean, one thing that comes to mind is we're doing a lot of different types of leadership training, which one is helping a lot for a lot of folks in some ways what that really means is actually learning to be kind to yourself and manage your own emotions and be thoughtful. It's one that's on its way to characterize some of what that training really undergirds. And I think that's been important. The reason I'll frame it also in this moment is, we found, and I think actually the literature is saying that for tools like AI, et cetera, folks who understand how to partner with them sort of in a leadership and junior colleague kind of way are actually often the most successful who can iterate and go back and forth and build those bonds. So we found that some of those skills around communication, understanding your own perspective and your own biases and bringing that into the workplace and working across silos and with tools are the skills that are most helpful. So we're investing a lot in that, both as a department, my department, and as a company.
Zoe, were you going to add anything?
I was just going to say, I just very briefly, because I think we can get to the next question. Genentech is constantly thinking about agility and future workforce planning. And you're absolutely right. We're actually doing something very similar to KP when we think about transferable skills and how people learn, communicate, and can move around. So really similar work that we're doing also at Genentech. We talk about future proofing our workforce and really thinking of 3 to 4 years out about the future. And it is less about, it's becoming less about, do you have 10 years of marketing? Rather, can you be a great performance marketer? Can you leverage an AI tool to create content? Are you obsessed with the customer and the insights? Like those are the types of things we're thinking about for future proofing our workforce because the medicines will change, the customers will change, the political environment, the access, all those things will change.
Thank you so much. And the last question is around the value of an MPH, and specifically, I think whether or not you have a degree in public health, if that qualifies you more or less than a more specialized degree. For instance, if you're applying for a job where you're competing with an applicant who has a traditional business degree or traditional marketing degree, kind of the pros and cons or just advantages of the MPH and how you think a candidate could stand out.
I think an MPH alone is not enough. You have to have an MPH plus other experiences and other skills. I think I would love to see when it's applied to, real life experiences. If I saw someone with just an MPH and no professional background and no experiences in the community or even volunteer roles, that would be a little questionable for me. But if I see that combined with, startup experience or internships or volunteer work with community organizations, that's really exciting for me.
Thanks, Kobe. Zoe or Anand?
Nothing specific to add on my end.
Yeah, I would just say I think, I felt like coming out of I have an MPH and a PhD, and I feel like coming out of my MPH, I could have hit the ground running. I don't have an MBA. I learned that on the job at Genentech over my first few years. So I think, if you're open to really having that learning mentality, that's the path I took. I got my Genentech MBA. But yeah, I think I appreciate Colby's comments.
Awesome. Well, thank you so much for being here and sharing your time and expertise with us. If we did not get to your question, please reach out to Eileen, Pearl, or myself at berkeley.edu, and we can forward those questions over to our speakers today. But again, thank you all so much for being here. We hope that this was a great learning opportunity for everyone who attended. And if you're interested in joining the Public Health Alumni Association and you are a recent alum, please also reach out to us. And again, huge thank you, Anand, Zoe, and Kobe for your time and expertise today. Thanks, everybody.